Hello, good afternoon, good evening, good morning, and welcome. My name's Nurse Richard, the Wax Wizard. 3 ears on this compilation for you today. First two very interesting ones. First one is something I've not seen for quite a long time. Now, can you see the little bump on the side of that this gentleman's ear canal? Yes, there is a lot of wax just smushed around the sides of the ear canal, which I cleared a little bit, and then I'll be honest, at first wasn't quite sure what this was, but when I just lifted that bit of skin up there, can you see there's a little bit of blood underneath there? So I wasn't sure if it was like a bony growth or not, and it's probably at this point where I'm thinking, ooh, what should I do about this? Should I, shouldn't I? But then when I lifted that up, you could clearly see that there's some old congealed blood under there, and also some dead skin. So we're pretty happy in the knowledge that you know, it's not bone, it's not something that shouldn't be, well, it shouldn't be there. To what the cause of it, don't know. But there's some fresher blood there. But I did ask him if he'd like poked anything in there, or remembers something flying in there and feeling a nip or something. Didn't recall anything, or had any trauma or something. Couldn't remember. So at the moment, I'm not trying to peel it away, I'm just trying to lift it up so I can actually see what's underneath it. It's why I'm not going gung-ho, just gently lifting it up to see if I can see what's underneath there. And there just appears to be a collection of dead skin with a little bit of blood in it. So I suppose the most likely explanation is it's a small hematoma. Hematoma, what's that? It's like a collection of blood underneath the skin. Lots of causes of that. You know, trauma is the most obvious one. But often we're not quite sure. But when I peeled it away, have a look, it looks absolutely fine underneath it. Yeah, it is a bit red, but obviously there's a bit of dry blood there. So I'm not entirely sure what caused it, to be honest. Now, it did spot another little bulge there. Whether that's an indicator of what's going on, I don't know. But I thought I'll just try and get rid of that one. This is all done with a fine end tube, by the way, the smaller of the two. So I just want to put my mind at rest, really, by peeling just that small bit away. And as you can see, it's pink underneath, which means perfectly healed. So that's more than likely going to be the same with all that red bit there. That's just dry blood. It's going to be pink and healed underneath that one as well. So yeah, not the full removals on that one. I spent forever and a day mopping up every little, not every little aspect, but I didn't want to put, it would have gone on forever, you'd have got bored. So just a highlight of that removal. Now this chap, he's been in one of my videos before, and it's because he had some exposed bone in his ear canal, the cause of which we're not entirely sure, but I did refer it onwards, and it seems like what they're doing is just watchful waiting. They just say, get it cleaned every now and then, keep an eye on it, and then if it causes any problems, let us know. So it comes to see me every 3 or 4 months, and we'll lift this collection out and just make sure that it looks the same as what it did before. I'm looking closely in that plug there, making sure there's no bits of crumbly bone in there. There you go, you can see that. Now, if you do find the other video, I can't remember what it's called, it might be exposed bone, you'll see it looks almost identical to what it did then. It looks nice and clean. It doesn't appear to have grown at all. And so it's probably the right management, you know. Gentleman's of a decent age, it's not causing any problems, doesn't get any infections, it just needs clearing out every now and then. Now this last one here, just 2 ears here. Fans of a sticky skin peel, you're going to like this one. It was difficult to remove though, it was really frustrating. It was a bit squeaky. Now it wasn't squeaking to the point where it was uncomfortable for the patient, you know. I would have stopped if that was the case. But when you get these squeaks, it obviously means there's a little flap of skin in the tube that's flapping around. It's called clarineting, if you don't know, because it's the way a clarinet works. If you're musically inclined, you have like a wooden reed, and then when you blow, it makes that reed flap, and that's what makes the sound of a clarinet. So when it does squeak, yeah, if it's really loud, obviously you come out straight away. But if it does squeak, it means you've not got a full seal. So sometimes to stop that squeaking, you just literally put the tube in a bit further down, so it completely occludes or blocks the suction tube itself. But it took a lot of persuading this one. Now I'm working my way around to try and like wrap it all up, to peel it away from the sides, and you can see, can't you, down the side of it, it is slowly peeling away deeper down, and it's at that point that's why I've started wriggling it. So hopefully we can start bringing it forward now it's all detached from around the ear canal. And it was a fairly substantial little skin plug. There we go. Nice and clean and clear afterwards. Good result. Now the other one, there wasn't much in this at all, just a couple of flakes. So I thought I'll just peel them off. Not take a minute, won't it? But as with a lot of skin peels, what tends to happen is the whole thing starts jumping into the tube. So I'm getting in on this as well. So again, it's a peel that I'm peeling it away, a bit blurry because there's a few hairs in front of the ear canal there. Excuse me. Yeah, tickling me throat. Cup of normally sorts it out, doesn't it? There we go. So you can see it detaching down the sides there, and hoping that the whole layer of skin comes away in the same piece, which I just need to grab it from the bottom there, and I'm pretty sure that's what it did. Well, that was extremely stuck and sticky. There we go. Hope you enjoyed this anyway. Thanks for all the new subscribers who've joined me recently. I know there's quite a lot of you. I don't know where you all come from all of a sudden. Something about YouTube's algorithm that's just gone a bit bananas. But welcome aboard. Happy to have you. Feel free to check out all the others. You've got 130 catch up on. So out comes that layer of skin. And let's have a look inside to make sure it's all gone. And there it is. Nice and clear. I'm not peeling all the way down to the drum. There's absolutely no need. That bit's probably not ready to come away anyway. But I hope you enjoyed that. Thanks for watching. Stay tuned for some more, and I will see you soon. Take care. Bye-bye.